Right, I will be helping Hillary today kind of moderate the meeting because she's feeling a little under the weather. So we'll kind of tag team it today. So welcome, everybody.
Welcome, welcome. So, sorry, I'm just running in from another meeting. All right. Well, welcome back to another semester. We are now 3 weeks into the spring semester and our first official town hall meeting for the calendar year. And so again, the goal of these is to provide an opportunity for me to meet directly with faculty and staff on the campus and to give greater opportunities for transparency and input and answer any questions and concerns that are coming up on the campus, but also be able to help respond to issues that are impacting our daily lives and our abilities to effectively deliver on the mission of the institution. So what I had sent out on the email last week, that there remain a lot of questions, concerns, obviously, surrounding COVID, the recent surge with the new variant, and some of the protocols and safety and health protocols that we have on campus. So I wanted to take an opportunity, certainly first, to address some of those questions and concerns. We talked a little bit about it before, and even this semester I've had already meetings with department chairs where we talked about COVID. We met with the deans, met with the University Executive Council, really to try to get out messaging on how we can be most flexible, most accommodating of the needs that individual faculties and staff may have and may be experiencing with the increased incidence of COVID in our community and on campus. A few things I just want to say kind of first off, just to address some questions and concerns I know that are starting to arise. And one is, I guess, regarding our commitment to scientific information and data and how the university has responded to that. All I can say really is that from day one of COVID, we have engaged healthcare professionals in conversations and the deliberation regarding everything that we have done, all of the policies that we've set forth on our campus. So these aren't things that are made by 2 or 3 people, decisions made by 2 or 3 people sitting in a room somewhere. They're decisions that have involved engagement with the Utah Board of Higher Education, with our healthcare team, working with state agencies, with the departments of health, talking with other campuses in the Utah system, and certainly engaged. There were regular meetings where our team was working with others from UBHE to address these healthcare concerns. So any illusion that that healthcare data, healthcare information hasn't been taken seriously and hasn't informed the decisions that have been made on our campus just would be in error. I will also say that we've done a good job of trying to engage as many people as we can. Faculty Senate representatives, PACE representatives have always been involved in the decision makings and participating in those decisions as we've made them throughout the last couple of years. So in terms of, I also will see some, we'll get emails, or we don't take our, exceptional care seriously. And what I do want to say certainly to the entire campus community is, this has always been part of the conversation that we've had. How do we effectively safeguard and provide protection for our campus, given the restrictions? And there are some real restrictions that we have in place. Certain things that we just can't do that I know that people would like and seem in some way to make sense, but there can't be mask mandates, for example, on campus. We just can't do it. The laws don't permit us to do that. And even in St. Louis, Salt Lake City County, where there had been a mask mandate that actually got overturned recently. And so the legislature is not moving in that direction. But we want to do everything we can and work with faculty, work with staff, listen to what your concerns are. This forum, I think, will helpfully provide us some opportunity to hear what some of those may be and do everything that we can within the constraints that we have in place to effectively navigate through the rest of this pandemic for the semester. So that's our commitment to you. I want to be here, want to listen, and we want to do what we can to be responsive and sensitive to the needs of everyone on campus. The first thing I really do want to talk about is we also sent out a message last week about specific classroom monitoring, and that's gotten some feedback as well because there's been a suspension over as the case counts rose. The decision was made again based on feedback from our healthcare team advising us on COVID that we should suspend the monitoring temporarily until it would become effective way of identifying hotspots on campus and effectively monitoring the situation. So I've asked Sue Jackson, and Robin Edmeyer is also here. These are our two primary people that we have that we utilized their expertise throughout the pandemic to come and talk a little bit about those decisions, answer any questions that you might have, and certainly to highlight what we're continuing to do on campus to address COVID in terms of testing and other options that remain in place, even though the decision had been made to suspend a specific course room monitoring at this time. So Sue, I believe, is here, and I will turn this over to you, Sue.
Okay, thanks, Wayne. I'm going to go ahead and share my screen so I can show you a little bit of what we're talking about here. I think one of the big misconceptions about what we suspended last week was that we suspended all COVID response, which is untrue. You can see here we have the fall 2020 response, spring 21, fall 21, now spring 22, and the different measures that we've taken to try and protect campus. I have in there the things that we can't do according to now different legislative laws. The 6-foot spacing in classrooms, just to be clear, that's not prohibited by SB 107, but because we're required to have 75% of classes that we previously did in person, now we don't have the space to be able to have 6-foot spacing. So just a clarifying note there. But the one that really, I think, got a lot of attention last week when we suspended it was this classroom monitoring and notifications. So notice that we're still doing the on-campus testing, the vaccines. We're still doing the weekly data reports. We're still doing contact tracing. All of that is still happening. It's this classroom monitoring and notification process that we suspended. So I want to talk a little bit about why we did this in the first place and then why we chose to suspend it. So this is your public health lesson for the day. Most of you probably know John Snow and have heard of John Snow. He is the father of epidemiology. So when we study epidemiology, we talk about John Snow. This is his map of London where he was looking at cholera cases, and he was trying to identify where they were getting it from the water source. So he identifies it at the Broad Street pump and takes the handle off the pump, and that's the famous story of where epidemiology spot mapping comes from. But this is spot maps for disease. So trying to look at where specifically the disease is coming from. It pinpoints the cause of the disease to actual location of where the disease is from. So when we designed the UVU classroom monitoring process, we used this epidemiological process to say, okay, how are we going to protect campus? The big reason we started this was to avoid university level shutdown. So when we looked at having shut down in spring 2020 and summer 2020 being all online, coming back in fall 2020 to say, how do we avoid this again? I know a lot of you come from professions where the students' clinicals were negatively impacted. I know aviation was losing thousands of dollars by being all online. So how do we protect campus in a way where a more nuanced approach? So rather than the medical, to use a medical term, rather than chemotherapy to the whole body, let's cut out the tumor. So we were looking at that type of an approach. And we used it to understand classroom spread. Those of you that met with us early on, one of the questions that we said when a class would trigger is there evidence of potential transmission in the classroom? So did student A get it on Monday and the incubation period being such that student B got it on Friday, and we can see that the student actually got it from this class? That's what we were looking at initially. It also gave individuals the ability to protect themselves in an era where we didn't have good prevention or treatment options. So if a student got a notification that they were in a class on Thursday that could have had a potential exposure, maybe they don't visit grandma on Sunday because we don't have a lot of prevention or treatment, but it allowed them to make those options. The other thing that I'll comment on is this is not universally done. This was something that Wayne and David Conley and I sat together and said, how do we apply epidemiology to the university level on a different sphere? So when we look at the state institutions, no one has done the classroom notification and monitoring system like we have. Most of them have relied on contact tracing or not notifying faculty at all. So this is something that was unique, and a unique position that we took here to try and say we were going to keep campus safe. So when we look at basic public health, this is the question that I had to come to last week is, are we doing more harm than good? So public health is population level health. It's not clinical or individual health. It's, are we doing more harm as a collective group than the good? So for instance, seatbelts are public health. That's a classic example. We know some people will die from seatbelts, but the vast majority will be saved by seatbelts. So we want the risk cost benefit analysis here to say this is actually a good thing we're doing. An article came out last week. This is a quote from this article. And if somebody has it, if they can include it in the chat, because I thought it was such a powerful article. It's about the University of Florida, who stopped not only classroom, they were never doing classroom notifications, but they stopped monitoring on campus altogether. And one of the quotes they said there is, transparency is an illusion when the data is bad. Likewise, you can't make good decisions by looking at incomplete or missing numbers. So I want to talk a little bit about how this data has gone from having holes in it to really being really faulty. So one of the things that we've lost is the health department has suspended contact tracing. We were getting notification from the health department if somebody tested outside our network, we then would get that case into our system and then we could trace them back. But if the health department is not doing contact tracing, that means I don't have record of any student who's tested anywhere but UVU unless they tell us. The governor about a week and a half ago asked people not to test. He said, save them for the most high-risk individuals. If you're sick, stay home for 5 days, assume you have COVID. The state had reached its testing capacity, and so we asked people not to test. So now we have people who aren't testing, so there's no way of knowing how much disease is really in the community. We have the availability of at-home over-the-counter tests, meaning that people can take them at home. I have no way of gathering that data. And then more asymptomatic or mild cases due to the previous infection or vaccination. So we're seeing people who in testing, they're testing positive, even though they may not have symptoms there. So let's talk about this potential harm and this cost benefit analysis. One of the things we started seeing come in on our self-reports about 2 weeks ago is specific blame to classes, instructors, and classmates. They are blaming the instructor. They are blaming you for getting COVID in their class, which may not be accurate. In fact, some of them just don't understand disease. So we may be sending out a notification that says, someone in your class was potentially contagious on Wednesday, and the student saying, oh, I had a sore throat on Wednesday, it's that class. And so there's a lot of specific blame there. And I think that tied in with this emotional political response. I can absolutely understand this emotional response. I know it's been a long 2 years. I look at the emotional side of, I have a type 1 diabetic who I've been trying to keep safe for 2 years. My dad lives next door. He's 85 years old with pulmonary fibrosis. I understand that emotional response. And we're in a point in this pandemic where everybody wants to blame someone. And so they're looking for a place to blame. They're mad about it. And I understand that. I mean, it's been an exhausting 2 years. But what we've done in these notifications is we basically put a target on our back saying, blame us because we're telling you about the potential potential exposure. It's this exaggerated risk on campus. You go to Costco or Walgreens or hang out with your friends, you don't get an email telling you you may have been exposed, which you probably have been. But because we're sending out these notifications, we actually look like we're causing far more disease than we actually are. And then on the other side, we get this callousness from the individual. So in health, I want to do something that actually triggers behavior change. The students aren't changing their behavior because of the notifications. They get 4 or 5 a week or even more, then they don't even consider how that might change their behavior. So they get this callousness because the notifications have become excessive. On the flip side, you have the false sense of security if a class is not triggered. I've had faculty on campus tell me, I assume my class is safe until you tell me otherwise. And I could never make that assumption. Right now, with the data as bad as it is, I can't tell you your class is safe. So I need you to use your best judgment on whether the class is safe or not. So I don't want this false sense of security that if the class hasn't triggered, that means it's safe to attend. Then we looked at what are we doing in this? So if a class triggers, it has enough notifications of potential exposures, then it would trigger. This is our system. And then we were sending out a mobile testing team. Robin's team has been so overwhelmed at the clinic themselves, we haven't been able to do that. And so we've talked about, should we move them remote? Is moving remote, the instruction remote, actually decreasing disease on campus? And so what we have to think through is, if a student has a 9 o'clock class, a 10 o'clock class, and an 11 o'clock class, and that 10 o'clock class moves to a live stream format, they're now sitting in the hallway instead of sitting in class. And if they are potentially infected, they could actually infect far more people sitting in the hallway than they would in class. So I don't believe that we're actually decreasing disease on campus by moving them to a remote format. The other side note that we've had in this potential harm to campus is this is something that I've been doing for 2 years with a student or two helping in this process. It has gotten to the point to try and keep this up. It would probably be about 12 to 13 people helping. And with each increased person, we have an increased risk of FERPA violations. We're not just talking about a little bit of data. We have names, addresses, class schedules, and now their health diagnosis. And this isn't just for students, since faculty and staff test on campus too. That all comes into the same pool. So having lots of people with access to that data makes me nervous. So as I look at this potential harm to campus, I can't say as a public health professional that I actually think this process is doing good at this point, even though it did at one point. So I want to talk about where this new chapter in this pandemic, we're 2 years in, our little pandemic has gone from an infant to a toddler. So how are we treating this, terrible pandemic here and our response? I think if you look at the contrast between where we were in 2020 and where we are in 2022, it's a very different situation. When we shut down in 2020, it was an emerging infectious disease that we didn't understand. We didn't know prevention, we didn't know treatment, we didn't have PPE supplies that we needed. There was no rapid testing. If you remember the days of 4-day waits for tests, mask wearing, most of us didn't own face masks to wear in public if we wanted to, and the death rate was quite high. It's estimated much higher than the seasonal flu. And now we're in a place where we have vaccinations. We understand we don't need to wipe down all of our groceries from the grocery store anymore. We know it's an airborne disease. There's lots of treatments in the hospital, much better testing options. We talked about over-the-counter testing options, better masks, and then understanding that the death rate from Omicron is much lower than previous strains. In fact, the death rate is looking to be similar to the seasonal flu at this point. And so when we look at what the response is, I want you to think about the seasonal flu and what we do for seasonal flu compared to Omicron. The other thing that I think we have to point out is that I'm unaware of any deaths that have occurred among our employees or students from a work or classroom exposure. We're 2 years in. I think that's something we should absolutely be celebrating, that we have not lost anyone from their exposure on campus. That is an enormous feat, considering 40,000 students here at UVU, that we've not lost life. That doesn't negate that there have been long-term consequences for some people, but we have not lost life at the university from our COVID response. So I want to talk about where we go here in our response. Some of you know I'm a half marathon runner. I was looking at Disney half marathons and this came up yesterday. And I thought it was an interesting warning and maybe one that we should all take. It says an inherent risk of exposure to COVID-19 exists in any public place where people are present. If you're around people, you have a risk for disease, whether it's COVID-19 or any other disease. Being around people has a risk of disease. So I think we need to return to a traditional disease monitoring in higher education. Faculty, everyone should wear masks when they're indoors during high risk times, get vaccinated and boosted, stay home if they're sick. And then faculty should ask their students to notify them when they're sick, watch for spread in their own classes, and make decisions in the best interest of their classes. This is not something we haven't done before. I've been in the classroom 13 years. I have done this far before COVID came along and the university was telling me whether my class was exposed or not. I had an epidemiology class that had norovirus run through it, which is kind of ironic, but we traced it through the classroom. And then I said, I'm going to have you go home, and instead of having class next time, you're going to watch a video on communicable disease, and took the class remote. We have dealt with 6 students before and how to cater to them. We have to shift back to where we can say this, for most, Omicron is not worse than the flu. So we have to look at it kind of like any other infectious disease and what would be reasonable. But at the same time, I do think faculty are in a better position to watch their own classes than to wait for us to try and watch it from the university level, given all of the harm that could be potentially done and the holes in data. So that was just a little bit there to explain why we came to the decision we did. It was never meant to be, oh, we don't care, not about exceptional care, but actually looking at the cost benefit analysis of this small part of the COVID response.
Okay, I was trying to follow some of the chat and questions that might come up. And again, there's an article that was published, there was an op-ed piece that was in the Washington Post regarding the University of Florida, which did stop its coronavirus, as Sue pointed out, tracking at a much higher level. So the recommendations here are not inconsistent with what some other major institutions have done as well. At the end of the day, one thing that I was thinking of when this information was coming is that, having some information is helpful, but I think Sue's point that saying that, that your class hasn't triggered that somehow that it's a safe environment compared to another classroom that did trigger, because based on the information was probably also given a false sense of security to those who would be walking around thinking, well, my classrooms haven't triggered, so I guess everything's okay, when in fact there could have been exposures that occurred in those classrooms. So anyway, I'm not a health, I'm a philosophy professor, and I know many of us come from a lot of different disciplines. We're all educated, we read the information, but again, relying on the experts here to guide us through some of these questions. Anything specific? Let me see, we do have some hands up.
Yeah, Provost Fox.
Go ahead, Robin.
Yeah, before
And Robin, just introduce yourself real quickly for people who
All right,
don't know you.
Okay, thank you. And I just want to give a little bit of information before we get into the questions. So I'm the Director of Emergency Management and Safety here on campus, and have been pretty much joint at the hip with Sue since the beginning of the pandemic. So we've been working on this for a long time. So a couple of things just for your information. As far as testing goes on campus, we are not following the same statewide advice. We have our own specific who we will test. We did send out a message last week, just letting people know that, we need to ration our tests, so we need to use them wisely. So there are some classrooms that require testing. We would continue doing that. If people are exposed, we would continue testing them. If they are ill in any way, have any kind of symptom, we would continue testing. So our testing criteria is a little bit different than what the state put out there. What we ran into, and it wasn't a problem until more recently with the expansion of testing, was that people would come every day and test just out of curiosity. And so we wanted to be more judicious with our test supplies. So we're being careful, and people have responded well to that message. And we are still testing those who need to be tested, but have been able to take out some of the testing that we just don't have the ability to do anymore. That said, test kits are hard to get anywhere in the United States right now. And so we are scrambling as a state and as a university to find test kits wherever we can, so we can continue with testing on campus. But for right now, for the criteria outlined, we are able to do that testing. The other thing about contact tracing is we have done that from the beginning. We continue to do that. There's nothing that has stopped that. It has been overwhelming in the last few weeks as you can imagine, with exposures and people who have tested positive, but we've never let up on contact tracing. And then as far as vaccinations, so we have all 3 vaccines on campus. Interestingly enough, as Omicron cases went up, so did our vaccination rates on campus. We have since the 1st of January been able to vaccinate 759 people, which is a big number compared to where we were last semester. Many of you will know we sent out a survey to the students, and I just checked today to see where we were on that particular survey, and I think we've been here for a while, but we are at 68% of the students, so just the students only, that are fully vaccinated. You will remember that whenever you mandate a vaccine, there is a law that comes into place that offers exemptions, and we've had 12% of our students who have opted to select an exemption. So the difference between the 68% and the 12% is they're either partially vaccinated or still considering vaccination. So that's where the other part of the 100% would come from. Another piece of information, and this is good news for us, is that I have been working for the past week with the CDC and the State Health Department to get additional testing on campus that would be for the community. So many of you will know we have said that we would test student, staff, and faculty. This testing is not run by UVU. We're just offering space on campus over where our drive-through testing is located. On this Friday, we will begin testing, and it'll be 7 days a week with 8 to 9 hours every single day. It is PCR testing, so it's going to take a little bit longer to get test results, but that will be open to the entire community to include your families. So we're happy about that piece. One last thing, and then I think I'll be finished here. Another, because of the testing and because of the announcements that have been made that, don't test if you're sick, just stay away for 5 days kind of thing. That also limited some of our, that decreased some of our testing numbers. But one other interesting thing, and some of you may be aware of this, is that the state since the beginning has been testing the wastewater, the sewage plants. And so I've been watching that pretty closely to kind of try to see, when, regardless of testing or not testing, what do the levels look like in the sewage plants? There are 42 sewage plants across the state of Utah that are tested twice a week. And as you look at the information, and that is located on the Department of Environmental Quality. And when you look at that, the area between literally Provo and North Salt Lake has turned a yellow color. So green means it's increasing. Red means it's decreasing. Yellow means we've kind of stalled. We're not increasing or decreasing. And in that section between Springville and North Salt Lake, the dots have all turned yellow. And as you dig down into the data further, all of it has dropped, even though it's not turned to the color that would indicate that the virus is decreasing in the sewage. They have to have 2 data points before they'll drop. But as you kind of dig down and look at that, which I felt like was, that's good news as far as where are we with Omicron right now, is we've kind of stalled out. We're not increasing, we're not decreasing. But if you look again at the, if you dig down into the weeds a little bit, we have decreased in all of those sewage plants. We need to have another point of data of decrease in order to start to see that color go down, which it's an odd thing, I guess, to talk about, but it's really good data that, in the absence of testing, kind of helps us to know where we are in that curve. Have we peaked? Are we on our way down? And it looks like we might be, starting that beginning of decreasing this whole thing at all. I wanted to, let's see, I think that's it. So that was all I needed to say about my part.
Thanks, Robin, for that input. And I'm trying to monitor the questions. One thing I just want to say, we're all on this isn't an administration versus a faculty versus a staff issue. We are all on the same page here. We all want the same thing, which is to create a safe environment for for everyone, for me, for you, for our students. And as I read, some of the comments, I feel like my hands are tied in the classroom. Our hands are tied. These aren't decisions that we've made in terms of whether or not we can require masks. We can't do it. The state law forbids us from doing it. If we were to try to do it, there could be all kinds of ramifications, both at the state level, not to mention, I would imagine, legal action that the students would initiate, or faculty or staff might initiate. I can tell you since this morning, for some reason, I've gotten a number of emails, some of them saying, thank you for not requiring masks and this and that on campus. I can tell you we get both sides of this issue. Faculty are equally divided on whether there should be mandates about masks or vaccines or whatever. So it's one of the most convoluted and controversial issues I've ever had to try to deal with. We're trying to navigate this as best we can, given all of the constraints that are out there. But I don't want you working in an unsafe environment, and I will commit to doing whatever I can do within the constraints of the law that I can to give you the freedom to protect yourself as you see fit, and doing things that we can do to try to navigate this. In terms of we've sent out, I don't know, innumerable requests for students to please wear your mask, There's signs up to wear the masks. I don't think me sending out another message, please, I'm absolutely doing everything except demanding you to wear your mask, is actually going to have a whole lot more of an impact. Any more than, I think faculty probably have the greatest potential for impact of wearing masks and we've said you can ask, you can make strong statements about it. You just can't require it. You can't do anything that would make a student feel they're somehow being disenfranchised for not doing it. But again, I want to get to the questions and I want to hear from you. Again, we will entertain anything that we can do to try to help you feel safe in your work environment. And we'll talk a little bit about some of the things that we have in place to do that. Dave Morin, you've had your hand up for quite a while, as has Mark Lentz and Nathan Toke. So Dave.
Yeah, I just wanted to, it's not more of a question. I just wanted to thank you, Provost and Robin and Sue. I know you guys are between a rock and a hard place, and that, yes, there are concerns. I understand that, but I really do appreciate that this idea that we are all on the same team. So, some of the things that came out this morning, it doesn't reflect every faculty, and there's a good number who are appreciative. So I know you guys put in a lot of work, so thank you. I just wanted to say that I know I represent what I'm saying, that there are other faculty that feel the same way. So just wanted to say that.
There are other faculty who have a very strong opposite view on the messaging, and so that makes it much more challenging. It's again, the community is divided. There's a lot of strong opinions on both sides of this issue. So, Mark, I think you're muted. The most common phrase of the past.
I am, yes, I am muted. I'm no longer muted. So I'm not gonna go as far as Dave did, but I will thank you for meeting with us. I mean, it is frustrating for a lot of us that it doesn't just feel like faculty voices are being included. It's being, I do feel like there is a mute button between me and everybody in the administration, except for you, Dr. Vaught, and I do actually appreciate you meeting with us for that. That said, one thing that I think would help a lot, and I've seen live streams and I've seen videos and I've seen people in leadership on campus without masks. We cannot require anybody to mask. That point has been reinforced. The source of that, of course, should be called into question, and we should really examine somebody who has a role in the legislature and the administration, basically doubling their influence in the state at the university and legislative level. That should be questioned. But I would really appreciate masking in leadership and sort of leading by example. I think that would definitely help. And I'm not naming names, but I have seen a lot of, in my interpretation, lack of leadership by people publicly not going about with masks in the middle of Omicron. And now to sort of go back to, I put my hand up at the end of Sue's questions, and I'm going to try to be short here. When she said at the end that, having faculty make their determinations about their classroom, if we had that kind of support in the messaging that's been coming out, I think a lot of faculty would actually see us as being on the same page and with the same goal. But the messaging that's been coming out has actually been incredibly weak in terms of endorsing faculty's control over their own classrooms. And I hope that would improve in future messaging.
Yeah, and let me respond. I met a message did go out to the campus and to chairs. And even when I saw the messaging that was going out, felt that I needed to have face-to-face conversations with the decision makers, the department chairs and the deans, so that questions could be answered. There's been a push, can I move my class online, for example, for the entire semester? And I have to say no to that. Based on state law, we have to offer a certain percentage of our classes in a face-to-face format. However, I don't know what the circumstances are. I don't know if you have kids that are sick. I don't know if you're sick. I don't know if you have an immunocompromised situation. We don't know the exact circumstances of each faculty member facing these decisions. So we wanted to, and I pushed to make it as flexible as possible and encourage chairs, please be as flexible as possible, especially in this heightened period of the Omicron virus. To work with faculty for these temporary movements to a remote delivery. And so if you feel the need to do that, and one of the reasons could be 5 students have sent you emails saying I'm positive for COVID, and is this a reason to say, okay, I think we should go to remote delivery here for a few class sessions? Absolutely. But I can't as an administrator, given the state law, endorse that be a full move. Another thing to keep in mind is that we've gotten complaints from students already. I was just talking with the dean over the weekend about students complaining about even some of these temporary moves online. And keep in mind, there is pending litigation. Students have sued the universities for moving classes from face-to-face to online back in 2020. So that, it creates for all of us, for you and for all of us, a challenging situation. That being said, I want to be as flexible as we can with faculty to make the decisions that you feel are appropriate to make for your classrooms. And we've asked department chairs to be, the president wanted some type of oversight for this, certainly in the president's council, for how this was done. So that we just didn't have people just shifting and things going around, because that gets kind of confusing for students as well. But you do have that flexibility available to move your class to remote on a temporary situation, and then, come back and the situation still exists. I guess you could do it for another temporary period of time, but you should feel good about doing that. And I've heard from your faculty senate president, again, who I've included and done everything I can to keep the faculty senate president involved in conversations. And I think she's here, and I think that she would concur that I've included her voice and trying to be a representative for the faculty in those. And she says one of the things that people have been expressed concern about is that they're fearful that they will be punished somehow if they do something wrong. And that's just not the case. If you're working with your chair, making a decision, you move your class temporary remote for a important health related reason, do so. And you have my sanctioning for making that happen. I just can't say you can require masks. And it's been brought up, actually, the legislator in question represents his constituents, not the university, Utah Valley University, in making those decisions. And so it didn't reflect, a discussion with the cabinet. It doesn't reflect the view of cabinet members or any formal recommendations, certainly by Utah Valley University. I think that legislator feels it represents the will of his constituents. That being said, what the bill actually did was push it down to the community level, to county health agents and county commissioners, which you saw Angela Dunn do in Salt Lake City, but now even that has been overturned. So it is very complicated in that regard as well. But that's fundamentally the county commissioners in Utah County have said they will not support a mask mandate. The issue about pushing back, I had the conversation. I was sitting in for President Jimenez in a Council of Presidents meeting, and I asked specifically David Wolstenhume, who is the, as you know, the Commissioner for Higher Education. So my faculty keep asking, have we had conversations with the legislature? Have we pushed on the legislature? And he says, yes, there have been multiple conversations. They have heard from health experts. And where we are right now is where they were able to come to an agreement about what would be done. That you're wanting some public statement or something, I mean, that, I think that you as individual residents and as individual citizens can certainly talk to your legislators about what you would like to see in place. But I don't think that we have any more leverage against the legislature. And in fact, what I'm seeing is they're going even further the opposite direction. So I just don't see, again, mask mandates as specifically as something that we're going to be able to do any time during this pandemic. But I am absolutely willing to entertain any other ideas and thoughts that you might have about things that you as a faculty member think, or staff, if there are any staff here as well, would make you feel safer and give you a greater sense of control over the situation. Nathan.
Thanks, Wayne. I don't know if you did yet, but yeah, so I guess what I would say is that thank you, Sue, and for everybody. I think what is happening now obviously has to happen. I guess the main reason that I think why faculty feel unsupported is kind of the timing, right? Because, this is during this big surge, when the hospitals are still full, when people are concerned about issues, therefore, with their elderly parents and things like that. I feel like we could have been doing a better job with messaging prior to the semester starting. Obviously, it's hindsight, right? We would like to have known what the situation was going to be ahead of time. But now at this time, when things are, in one sense, about to be probably much better, but right now, maybe at their worst, they feel unsupported in that like a rug's been pulled out from under them. And I know that, we do have support from as the faculty chair to potentially do some things to provide support, but it, the messaging, the timing just, I think doesn't feel right to those who are receiving it. And that's probably why we're getting a lot of flack, I would imagine. And I think we could have done better at the beginning of the semester too. Like when I tried to meet with my department, I didn't feel like I had any information going to that meeting the week before semester. I think we were like a week behind everything.
Yeah.
That's all I want to say.
Well, and hindsight is 2020. We had a lot of conversations at the beginning of the semester. We were trying to make sure that everything was right in terms of testing and monitoring and the things that were going on. We had additional messaging that went out to any of the students who hadn't indicated their preference on COVID. There was a strong push. The vaccine mandate was odd, and I know there was a question: why don't we do a better job of forcing or requiring students to indicate what their preferences were? Part of the reason was, one, it was so broad. Basically, all you had to do is have a personal reason, like I don't like needles, and that is sufficient. There's no guidance as to what a personal exception was. And so religious reasons, we were not actually going to get a committee together and review students' religious exceptions and decide which ones were valid and which ones were not, because we just didn't feel that picking up that lawsuit was something that would be in the university's best interest. and then the health reasons, as well. So the part of the reasoning was that the ease of which a student could get out of it was so great that attention really was to try to encourage as many students as possible to get vaccinated and to really push that messaging out. And I know Robin can talk about it, but we've been vaccinating at a pretty hefty rate, and even last week I think the vaccine rate was going up. So anything that we could do to encourage it is what we were trying to do in that early messaging. And Robin and Sue, I don't know if you have a response to the most immediate concern of, was there something we could have or could have said at the beginning of the semester going into this rise in increased cases? We're always looking to do better. I don't think any of us are perfect, and we really are trying as hard as we can to be responsive to your needs. But Robin or Sue?
Yeah, so we were watching, Omicron from, towards the end of November was when it kind of popped up, give or take a week in Africa, and then it didn't take any time at all to get to the United States, and the East Coast seemed to be hit a little harder, faster. And so we were watching it, but the timing is interesting because it didn't really come. It came and it was here in Utah fairly quickly, but you just didn't see numbers. And the numbers started really, when you look at the numbers skyrocketing, it's just a few days before we started our semester. So that week really before the semester started, the numbers started going up, and we were scrambling because we were surprised. I shouldn't say we. I was surprised at how fast they went up. So fast. It wasn't like the other waves of the other, of the Delta variant and the original COVID virus. It just skyrocketed so fast, and we were doing the best that we could do to get messaging out as we watched those numbers increase. It would have been, hindsight, again, it's like we saw it coming, right? The East Coast numbers went up fast. We could assume our numbers would go up fast, but even that was over Christmas break. So, getting everybody together over that period of time, it was just, for us, it was a little bit of timing. But, that said, we're always looking and how do we improve? How do we communicate better? How do we do it better? So it's, it's a good point.
Yeah, and I'll concur, it was it hit faster than we anticipated that it would. I watched the numbers every single day, how many cases we have on campus, and it wasn't a gradual increase. We got hit hard about Wednesday before spring semester started. And, Robin and I were both just trying to deal with the crisis in front of us. It wasn't about not letting people know or, trying to manage what we were going to do. We were hit by that. And Robin's team, the same way my team, this is contrary to what it would appear. This is actually not my day job. So, trying to jump back in. We've done Delta. We did the first round. This was different. So, yeah, absolutely. We could have done something differently. I don't know how we would have known what was about to hit us until it did.
And the question about vaccines, I'd have to go look at the actual numbers, but I can tell you that since the beginning of the semester, the majority, I would say definitely over 50, somewhere between 50-60% have been boosters. So that's been really good to see people coming in, getting their boosters, because I agree that adds a layer of protection from this, from Omicron. So yeah, a lot of them are booster vaccines.
And some more hands up, and I was seeing Hillary made some comments about being home and needing to, herself removed to remote delivery. I want to make it clear to the chairs, and I don't know if it's because the chairs are anxious or the faculty are anxious or what there's not a punishment. We want to empower you to make the decisions that you need to make to protect your own health and safety, to work effectively with your classrooms. We will be supportive of that on a temporary basis for you to make the necessary adjustments. How long temporary is still not exactly clear, because we're anticipating this, Robin, right, to kind of the numbers to start to precipitously drop here in the next couple of weeks and be back to a Omicron level of infection.
Yeah, so I was actually talking to someone on the East Coast just this morning, and we were comparing contrasting numbers. And he was telling me that they seem to be about 2 or 3 weeks ahead of us, but they said when they started to drop, they dropped fast. They dropped almost as fast as they went up, and it was just an exponential drop. So I'm hoping for that. And then, not to say we would stop everything COVID related, we wouldn't. We're, committed to do this throughout the rest of the semester, and we keep evaluating all the time what we need to do and how we need to change it and what needs to keep going forward.
John Hunt, you have your hand up, and then John Jarvis.
Thank you, Wayne, for this. Yes, I'm just concerned that we need more vigorous leadership at the top. I walk through the halls and I see mask recommended or mask suggested, but there could be, I think it was Nate said it, more vigorous messaging, maybe a campaign where the president, highly encourages it. Just being more creative about how we message our students about the importance of wearing masks, I think, is critical. The other issue I have is I received an email about a week ago about one of my students having COVID in the classroom. It's the only official one I got from the university. And in the email, which was actually posted as an announcement on my Canvas site, the email told the students they could keep up with the class via the recordings that are being taken. Well, I thought those recordings were optional. If the professor didn't want to use them, then he or she didn't have to post them or, make them visible on their Canvas site. I'm having them being visible, but still, the decision that the person who sent the email out was made for me, right? She made the decision to tell my students that they had access to the videos. When if I didn't have that opportunity for my students, it would have made me look pretty bad in the, to my students. So I think that's taking away some of the professor's right and the faculty's right to manage their own classroom. So that's a bit frustrating, particularly in these first 2 weeks where it's hard to keep track of the students. It's a mess out there, to be honest. So I think a lot of us are just really concerned that there could have been some better foresight in approaching the beginning of classes. That's just my 2 cents.
Well, the students were actually messaged that videos might be available, that they should check. That was the messaging, general messaging that I know that went out, that they should check with the faculty in case that is available, still giving faculty the discretion on how to use those. So there may have been a different message that was coming out specific to this COVID, and
that was the message I got. It was definitely more positive about no might. That was you can't see this. So
yeah, that was inconsistent with the messaging that had gone out to students at the beginning of the semester.
Thank you.
Mm-hmm. And let's see, last hand, we got some more popping up. That was John Jarvis.
Hi, I think this question is probably for Sue. You had a slide you showed earlier that said that no one had died who'd contracted COVID on campus. And I believe you, I'm not saying that's false or anything. I got an email last semester about a student who died from COVID, but she was an internet student and specifically signed up for internet classes because she knew she had COVID. I was just curious if you had any kind of knowledge of the number of students in a position kind of like that we've lost. I was just curious.
I only know of one, and I think Robin knows of the same one. We lost a student very early on, but in terms of, my statement was from a university exposure. There's no one that we know of that has died from COVID, but I do know of a student who was not on campus. It was actually while we were shut down that we lost a student as well. I'm not aware of the one that you're talking of either. No, but that data comes. Dean of Students office that tracks the deaths across campus for students of all different causes, communicating with them.
Well, thank you. I was just curious. I know there's going to be people who you can't track everybody, and it's going to be in that case. Thank you.
Well, and that's not to say that we haven't had people who've been hospitalized and very ill. that are in our campus community. But that we know of, we just have the one student who wasn't currently registered. It was the summer anyway, but still belonged to us. I mean, we still felt like they belonged to us, registered for classes or not.
Very good. Okay, that was John and Jenna.
Hello, can you hear me?
Yes.
Okay. Apologies if this question was answered, but are we still asking students to self-report even if the monitoring is down? Is that data available on the dashboard? And is there a plan to potentially unpause the monitoring in the future, or is it kind of up to you in terms of what happens next? Thank you.
So I can just say that, yes, just as much as ever, we ask people to self-report an exposure or an illness. I'm not sure we've decided yet when to unpause, as far as doing the classroom monitoring. We get a lot of that information through contact tracing that we still continue to do about exposure and illness. So we do get a lot of good information, and what's on our website right now doesn't, it's not going to reflect whether we pick this back up or when we pick it back up, but it does have our % positivity. It does have test cases. You can look at all of that on the COVID info website. In fact, I was looking at that this morning, and we're kind of right there at the top of it, right about 20% positivity. But when you look at the tests conducted, those negative and those positive, we have dropped a little bit.
Yeah, and in terms of the,
if you don't mind, may I just ask the question? I have a 1 o'clock class to go to.
Oh, sure, Masood.
I had a student the very first day of the semester. He was very, very sick, and he coughed 70 out of 75 minutes of my lecture, and I had no idea what my options were at that time. So would you tell me, what are my options as a teacher when I see a student sitting there without a mask and quite sick?
I can answer this one because I did it before COVID, teaching epidemiology. I dismissed the class, sent an email and said, please don't come if you're sick, or, talk to the student privately. But I have dismissed classes completely, said, we're going to end there for today. We'll pick this up next time, because I did not feel like the environment was safe. Just as if you had an active shooter notification on your phone and said, we're going to pause there for the safety of the classroom, you could do that.
This is one of those cases where, if somebody, I would discreetly approach the student wearing my mask and suggest that if you have the videos or available, it's like, you appear to be sick. It might, know that you have this option available to you. You can watch the videos online. I'll be happy to answer any questions that you might have in class. But it would really be best that you may or may not have COVID, but there's no reason to risk during this time. So that would be my first approach, would see if you can get the student, approach the student, see if they will leave. And if not, then you can dismiss. And if students, were not complying, you can always contact Student Affairs and they can try to intervene on your behalf. I wouldn't demand that somebody leave the class or try to take issues into your own hands, but Student Affairs is there and student conduct is there to help if you have a situation that's arising where you're having this problem, and they can try to help you work with it. Hopefully that student would, say, okay, I'll step out, or I'll go, watch it. But then, as to Sue's point, they leave your class and they go out and sit and cough in the hallway all the afternoon until they get to their next class. And we're still having an issue of exposure on our campus. And fortunately, I'm hearing all kinds of stories of people just not taking it seriously and not doing things to protect others. And that's unfortunate. Now, I think the good news is, and I was reading the Times myself, Sue and Robin, please correct me, but if you are yourself vaccinated, if you do wear a mask, you're creating for yourself a relatively low risk in this, because the last report was those who had received the booster, like I think it was these 80-90% effective at minimizing your risk of having serious complications or ending up in the hospital. So even though we're having some trouble getting others to comply, if you have done this yourself or can, then that's good. Now, I know that there are some faculty or staff who have immunocompromised issues or reasons they may not have been able to get vaccinated, and we've encouraged them to, go to HR, get an exception, and, there are ways of addressing that issue as well. We don't want to put anyone at risk who can't protect themselves. But Sue and Robin, any thoughts about that specifically?
I just say about the vaccine, absolutely, that the data shows that Omicron has sidestepped those that are vaccinated if it's been longer than 6 months. And that's why the boosters have become important. If you've been vaccinated in the last 6 months, then you do have a higher immunity. But if it's been longer than 6 months, then we absolutely suggest the booster, and that does up the immunity. As far as campus goes, we talked about our vaccine rates. We actually have some pretty decent immunity on campus with vaccines, boosters, and disease itself, because once you've had the disease, it doesn't mean you won't get it again, but you have an immunity for a period of time. So our immunity on campus is so much different today than it was 2 years ago. We had nothing, and now we have so much more. And so, there's that. So I would encourage you to get boosters if you haven't gotten boosters, regardless of Omicron. If it drops off in 2 weeks, I don't know what's next, but the booster has proven to provide some better coverage as far as immunity goes. As far as I get a daily report from the state health department, and every once in a while they'll dive deep into those that are hospitalized. There was a question, that's why I'm bringing this up, and their vaccine status. And we're still very much at a very high percentage of people being hospitalized and in ICUs are unvaccinated. There's still, there's a lot of breakthrough cases, that. I think we're at about 6% at this point in time in the state. It was 1%. Now we're up to 6% of people that are breaking through post-vaccine and still getting sick. But, by far, the people who are very, very ill and in ICUs are unvaccinated. I mean, we could get into a huge debate about, underlying health problems as well, but this probably isn't that conversation.
I don't see any other hands up. I'm trying to also take some notes just on what I'm hearing, general better and more frequent messaging people feel would be helpful. And I'm we always sit and we keep saying better, more messaging, and we've been trying to message things out. I don't think you can ever message enough. And so I will take that back, and we'll work on trying to be more frequent. One of the challenges is this has been so changing, and it's like 1 week everything seems, and then the next week everything changes. And so that's why I've been having one of the things that I'd set up for the semester is meeting every week with every department chair, so that we can hear what the concerns are and get the chairs to take messaging back. So it had been one of the strategies that I had tried to use to, in real time, hear what's going on and get messaging back that I was hoping would be getting back to faculty. But I mean, we will be committed to doing that. More flexibility with remote learning environments, and faculty having the ability to do that, and the messaging that we did send out last week. And what I've tried to reemphasize today is that we have done that to the extent that we feel we are allowed to do so by law. And removing remote, you will probably start getting student complaints. And so, but that has to be balanced. I think if you're communicating to them, that's the other thing that we often hear, is students getting communication from faculty, or a lack of effective communication in terms of what's happening with their classes. So if you do that, I think that will help address some of the flutter that comes up when classes change their delivery methods, if students don't exactly know what's going on. But right now you have some flexibility as you see fit. There are a lot of faculty that don't want to move their classes online though, and they've made that very clear to us. So I don't think we're not taking, that's why we can't take this one, blanket approach to it, because there are a lot of different perspectives on what faculty are wanting to do, but we want to work with you to be as flexible as we can and to make you feel, as Lydia, I think, put in there, that in spite of the fact of me saying there's no punishment for, managing your classroom, that there is a sense that there has been or a punishment, and I do whatever I can. Again, we're on the same page. I don't want this to be an administrative versus faculty issue. I'm really trying to, I want it to be where we feel that we're working together in tandem to promote the best interest of the campus and of you and of your students. Let's see if I don't see any more hands up. So other than what we've got in place, so we're, as Robin said, we're still doing testing, we're still doing contact tracing, still doing all that. The recommendation was not to do this one specific classroom monitoring because the data did not seem to be helpful and may have even been providing a false sense of security for people. The idea is like you're running your classrooms, there's a good chance that there's an exposure in those classrooms. And so now you make what you feel is the appropriate decision for you and your class, understanding that to be the situation that we're currently in. And Sue, I think she's still here, but I imagine we would probably return as soon as the numbers again start to drop, and we can use that information in a useful way to help limit or restrict transmissions on campus, that we would reinstitute that plan.
Yeah, I will watch the data. I mean, if it's, like I said, my profession is public health. I got to look at the cost benefit analysis. If we're looking at a disease that is similar to the flu, I don't know that we should be tracking it long term. I think we should treat it like every other infectious disease at some point. Start to have other variants now that get to be more deadly, then maybe we go back to that. But I can't, as a health professional, go back to something that I feel might be harmful to the campus and I know is incomplete data. I'm not willing to go there unless I feel like it's making a difference and making a positive impact on campus, because that's what we've been trying to do. It's never been about anything other than what do we think is going to keep campus as safe as possible so that those of you that want to be in the classroom can be in the classroom and continue these students through their educational process. That's what it's always been about. So whatever, the data says in terms of, whether we should be doing that or not.
And even from this, and Lydia, yes, I mean, I trust the faculty. When I hear that, actually, it kind of bugs me. And we've got to figure out together how to get past it, because I want you, the faculty, feel that you are trusted and that you're part of the decision-making team on all things academic. And I hope that the administration, I want to feel that I'm trusted and that I really am working to promote the best interest of the faculty and advocating for you, which I have tried repeatedly to do. So, we got another hand up. Mark Lenz.
I'm going to unmute myself. I think there were quite a few questions that I put my hand up because it looked like questions were out. If anybody else put anything in the chat, I would be fine with prioritizing them.
I'm trying to read it. It's hard to read and pay attention. But if anybody sees something, raise your hand if I'm not.
Yeah, I'll go ahead and go since
Go ahead, Mark.
Unfortunately cut the line. I am concerned about the camera policy, and I saw that there were some questions in that. John Hunt asked a question germane to that topic as well. I think there is, from people who've communicated with me outside of this as well, a deep distrust around forthcoming policy on that. On the one hand, the administration has downplayed COVID. On the other hand, they've said we need to have these videos in the classroom. Some of the messaging has been inconsistent where this is going to be optional. Already we were, and I understand the legal reasons behind it, but we were misinformed that we could delete these recordings. Now we can't because there's a lawsuit in effect. We also have seen in the past month or so that faculty input has been a lower priority in the development of a COVID response. How can we feel that our input will actually matter when we develop policies and procedures around these recordings?
There was temporarily a hesitation on the recordings because of that litigation, but that point was clarified that it only applied to spring of 2020. And as I understand right now, faculty are capable of deleting any of these videos at their discretion in their classes. And that's what I've been told. That's my understanding. And so faculty should be able to go in and to delete them. But there was a moment where there was this uncertainty because the litigation was a bit uncertain. In terms of policy itself, I think that we do need to do some work, and I had put it on the agendas, and I've talked to Hillary a few times. I keep saying to her, we got to talk, we got to have time, we got to have a real meaningful conversation about this technology. It's in the classroom. We spend a lot of money to put it there, and I think that faculty should take advantage of it where they feel that it will help their pedagogical styles and methods. I hear from a lot of faculty, particularly, in math and sciences, where a student might be struggling with certain concepts or math, and they go back and they watch that video multiple times. And I think me as an instructor, I would like to think, wow, that student went and watched my video 15 times and didn't come and say, hey, I need to make an appointment, so that I can deal with other issues and challenges. I think that the technology can be used to enhance the classroom environment for instructors, and to the degree that it can do that, we should promote it and allow you to do it. I don't see post-pandemic that we're going to have mandatory recordings of classes like we are doing. Part of the challenge there was that it was just so massive. I mean, we're talking about 6,000 sections of courses being offered at UVU in any given year, and now, only a percentage of those are face-to-face. But my guess is that, it would be something that would be at the discretion of the faculty member, some way in which you opt in and you let them know that classroom needs to be recorded at a certain time. And we'll have to figure out how to do that in a way that doesn't create mass chaos and overwhelm the system. But that would be my anticipation. There are intellectual property issues and questions that I think that some of the policies need to be shored up regarding that. And so I do want to get faculty input. And, how can I assure you? I don't know, other than to say that, and Ann is here and Hillary is here, two presidents who worked with me, not under me, was alongside me, I should say, as co-conspirators in managing the academic affairs. And maybe they have some insight into my style and into my perspective on faculty governance and their role in decision making. But I've been on the phone with Ann at 2 a.m. talking about these issues and trying to say, hey, before this goes out, I need to get faculty. What are the faculty going to say? What are they going to do? How are they going to respond to this? How is this going to be interpreted? Obviously, we can't get all of, we're making decisions on the fly oftentimes on some of these issues. What prompted one of this last debates was, the Alpine Schools announced, I even got the message myself on a Wednesday or Thursday that they're closing down Friday and Tuesday. And we were like, well, how's that going to, my first question is, how's this going to impact our faculty? How's this going to impact our students? What can we do? How can we move quickly? And so obviously you can't get a group of faculty together to make a decision on the fly, but I immediately turned to Hillary and said, okay, this is what we're thinking. We need to get you involved. I know Violetta was able even to come to some of the meetings when Hillary wasn't. So I don't know if the two of you have some thoughts, but I don't know what to say other than I am a faculty member. I see myself in that way first. I've always respect the voice of the faculty and have done everything I can as a provost to include a faculty voice in these decisions as they've been made. If they have different opinions of that, they certainly are free to express them. But
well,
Ann's got your hand up.
Yeah, I'll just make a quick comment coming off of that, is that during my time as Senate President, at least, there was actually some resolutions, for example, that we made in relation to COVID situations of past. or the starting point. And those were actually accepted by academic affairs, and that led to some of the responses that happened. SRIs being one of them, extension of the time of the tenure clock being another. So the academic affairs is open to things like our making recommendations, again, within the bounds of the law. One thing I do have to speak to that I think a lot of faculty don't, unless the faculty senate president represents all faculty in a number of circumstances. So when we're in board of trustees, we're in president's council, the faculty are represented by the senate president. Now, whether or not everybody in that room agrees with the viewpoint of what the faculty senate president is trying to say is a completely different thing. And whether or not Wayne or academic affairs agrees does not mean that all trustees and all president's council is going to agree either. But there is representation. It is limited to the Senate president in some of those bodies, but it is our job as a Senate president to do everything we can to represent all faculty across the board, including adjuncts. And then we try to bring that, we try to get as much of the voice as we can from faculty so we can channel it up that way. Good ways to do it is those conversations in Senate, right? Because those are documented things that we can reference back to. Hillary, I don't know if you have any added comments.
No, ditto, and thanks.
And to Alex Simon's point, I'm not saying I'm just following orders and I don't think anybody said this is just like the flu. What Sue did say was that the numbers are consistent with numbers that you would see during a flu-like outbreak. And that's not interpretation, that's just the data points that could be verified. I'm not following orders. I do have, and we all have as a public organization, an obligation to comply with state and federal laws. I think that, you as individuals, again, public faculty and public institutions have considerable above and beyond tenure rights to speak out on matters of public concern as private citizens. And I encourage you as your provost to speak out on matters of public concern as private individuals. I don't know why I would encourage you to do anything else or fear that the university would have any way of, any reprisal for you acting upon your constitutionally protected rights as a citizen. So I'm a strong proponent of that. And remember that not all of your peers on this institution want a mask mandate as well. There's a good difference of opinion on that too. Anything, if I seeing anything, again, put your hand, let me shift over. Rick.
Yeah, I've heard a couple of times that, the faculty are divided and I know that to be true. I mean, I get on the elevator with people who aren't wearing masks. Don't we have a responsibility as a university to endorse the best of science and the best of knowledge? That's my question, right? And you're going to say it's idealistic or something like that. That's my job. My job is to be idealistic. My job is to teach youth, I don't think we're pushing back anywhere near hard. And I think the faculty who are pushing back, we are modeling what should be done.
Okay. You mean, what would be examples of the type of pushback that you're looking for? Because as I mentioned, there has been, this isn't going to be publicly available information, but there have been a lot of conversations. The presidents have talked, the USHE has talked, there have been conversations with the legislature. What type of pushback?
I get the feeling that we're
for?
very concerned. I get the feeling that we're very concerned about offending the legislature, right? And I think that's probably true. And I've got it from some of the comments I've read. And I get it, right? I mean, there's a political aspect to being an administrator. I get it. But I don't know that you can expect the faculty to endorse that position, because we are interested in and I don't believe in absolute truth, but the pursuit of truth. And I think the pursuit of truth right now is showing that we should be wearing masks, and we should be, making people have vaccinations. I went to the opera on Friday, right? Who cares, right? But they made me show, a vaccinated and boosted card and wear a mask the entire thing. Now, did they have to make me? No, because I was going to do that anyway, right? But why does the Capitol Theater care more for the people who are going in than and I'm not saying you don't care about students. I'm saying we have to take a stand against legislators who are, I don't know, they're falling down on the job. They're stuck in the politics of it. Maybe you think my position is purely political. It's not. It's purely moral and ethical. I feel like I could cause a student to die, or some student's kid to die, or some student's aged parent to die by teaching face-to-face. But I won't teach just online, because if I teach just online, then that forces adjuncts to teach face-to-face, and we don't pay their medical insurance. So I think this is this is a moment where people in education need to take a stand for the facts.
Now, of course, the difference between the opera and us is they're a private entity and we're a public institution, and so they can do whatever they want, as can BYU, but we can't. And, I don't know that to say that we're concerned about the money part. I mean, the legislature does control 50% of our budget. And if we were just to adamantly say, hey, we're doing this, there are all kinds of things that could, withholding funds that I guess could come. I don't think that any of us sit around thinking, oh, we're, that's why we're not doing X, Y, or Z. I think that we recognize that as a public official, I have a responsibility to uphold the laws of the state of Utah and the state of Missouri, but the state of Utah as such. And I'm not sure that, the voice of the faculty, the voice of individuals as private citizens, I'm not sure that might not carry more weight than anything that I would say or try to do in working with the legislature, because most of them don't care what I think. They would care about what their constituents think. So reaching out to them and encourage, that would be kind of, I guess, I'm not endorsing or any position or taking any position or encouraging you to do anything in any way, other than if you do, I would ask that you not do it with your UVU accounts, because that would be illegal as well. But no, Rick, I don't want to I'm not in any way trying to make light of this. This is a tough situation because there is a law. There is a way in which mask mandates could occur on our campus. And that would be the county health commissioner makes a mask mandate that the county commissioners uphold. And if they were to do that, UVU would be able to have a mask mandate. But unless that happens, my hands are completely tied. You can ask students, and I encourage you to ask students in your class to wear the mask. Even talk to them about why and the risks and how, I don't know if you say I don't know how far you should go or can go, and I guess I should not even going to try to endorse it. You can ask people to wear your masks and wear masks in class. I support you in doing that 110%, which is impossible. I support that 100%. But then my back gets up against the wall and saying, hey, I'm going to endorse you violating the state law. The cabinet is not going to. It's not just me. This is a cabinet. They're not going to support that particular thing. That being said, what else can we do? So the flexibility was one of the things I know that people wanted. And I've tried to do, again, what we think that I say, cabinet makes these decisions. Cabinet work. I mean, this isn't one person making decisions, but certainly have advocated to give faculty as much flexibility as they possibly can in making decisions about their classrooms in this difficult time. So you have that. Is there anything else? We got 5 minutes, but is there anything else that I can do, I can take to cabinet? Anything else that the university can do to help you not feel like you are more supported, but to actually be more supported? Mark and Ann.
I'll go quick. I just wonder why we're all being crammed into very small classrooms when there may be other classrooms available. And I would like to see options, because it seems like the pandemic's with us. We could be thinking for the future, and we could have outside classrooms. We could be doing major overhauls of ventilation. We could be moving students and professors outside of closet-sized classrooms, regardless of the class size. But those are some of the changes I would like to see. Ventilation matters, we all know that, but we're not really, the infrastructure is not changed around that fact.
Certainly work. I mean, if there are classrooms available, work. One of the challenges has been we don't have a lot of really large classrooms. We got a lot of really small classrooms. And unless we were to go back to what we did, remember the first semester of the pandemic, half the class could come and half couldn't. And everybody really seemed to hate that. We got a mandate for the percentage of classes by state law that the legislature put in law, the percentage of classes that we have to offer in a face-to-face format. So that, as Sue pointed out earlier, makes it nearly impossible for us to do what you're suggesting, that is put, a class of 20 people in a 150 classroom, because one, we don't have enough classrooms of that size, and we got too many sections of classes that we need to offer without going back to another modality that people were equally not happy with. But I'm happy to figure out strategies for working with that as best we can. But that's kind of what's created some problems there. Ann.
So 2 other things that you probably can't solve now, but I guess if there's going to be another communication, I'd be curious to get some feedback on. So one is, if there's a faculty member who wants to change their modality temporarily or otherwise, and they are not in agreement with their chair about that, can they go to somebody like Najon, right? Is there somebody that they could talk to if there's differing of opinion between a chair and a faculty member?
About the transition to remote?
Yeah, so even if it's just for short term, like I want my class next week to be live streamed, right? So I guess just, and maybe you can't answer that right now, but if there's, I don't think it's going to happen that often, but if it does, what would that faculty member or chair do?
But the faculty member would talk to the chair. If the chair is unable to resolve it, they would typically go to their appropriate associate dean or dean of the college. If the dean is unable to resolve the problem, then it would come up to Kat Brown as the deputy provost and faculty affairs liaison, and then she would farm that out to the appropriate person to address it as best she can.
Perfect. So okay, that's wonderful. And then number 2 is, I know, so that whether you can hide a video or delete a video, that's up for debate currently, apparently. But no matter what, you can make it so students can't see it, right? One of those.
Correct.
So that's fine. But then I know there's a couple select faculty that I think would like the ability to edit. And I'm going to guess that is not a majority of faculty that want to go edit all of their classroom videos. But if a person does want to edit, if they are one of those individuals, can they do so? And if so, could they get help from like OTL?
I've heard about that, and I think the answer is going to depend on how many faculty want to do that and what resources there are available and what faculty have know-how in order to do the editing. I would always keep a master copy of any video that gets edited down for the obvious reasons. I know faculty are sometimes, I hear they're worried about some student using the video or posting it in somewhere inappropriate. Keep in mind that any student can video record your class without your permission and post it anywhere they want, and we can't do anything about it. They're protected in so doing that.
If you
on their
were one that,
phones, but-
if you were one though that just, you had a fumble and you wanted to edit it out, let's say.
Oh, yeah. I don't
Um,
think there's any problem with doing it, no. If
Okay, so
I
if you're
can't
one of
promise
those,
the resources are there to edit 6,000. I can't remember how many hours of tapes they told me, but it was like hundreds of thousands of hours of tapes or recordings. We are at the bewitching hour, and I don't know how many people we still have hanging around with us. But I'm more concerned about answering. 127 people are still here. Let me check and see. 1 second here. This must be important to some people, I suppose. Okay, I can.
There's a question I think I can answer.
Go ahead, yeah.
By Jenna about the testing, so I can talk to that. So, we talked earlier about just being judicious with our test kits and just making sure that we're using them for the people that really do need them. The State Health Department is scrambling, as everyone is, to get more test kits, and they are saying that, and this would have been a week and a half ago, that it would take about 4 to 6 weeks for us to get test kits from them again, because that's our source, that's who we get them from. And so we are, we've beat every bush out there to find anything, and then again, kind of prioritizing our testing. So I'm hoping that we, when we do get test kits again and it's a steady flow, then absolutely we will open up testing to whoever would like to be tested for whatever reason. And then just remember that there will be the PCR testing coming to our campus this Friday, and that will be there 7 days a week. And then I guess how you will know this will be that we would put out an announcement, but it'll also be on our COVID website under our vaccine portion, that we would have additional testing, or that we can lift those more restricted rules and it would be open up to everyone.
John.
Hi, Wayne, hang in there. It's not a question on COVID or on recordings.
No, something new?
Well, sort of. It's the UV meeting on Friday. Can you give me an idea of what the goal of that meeting is?
Which meeting?
You're meeting with the UC.
We're just going to talk about some proposals for some restructuring and get feedback and start a process of getting faculty to give us feedback on how those proposals might better support the varying programs and services that are currently within University College and outside of University College. So,
with that in mind, is there a way you can send out the proposals you're going to present so we have some time to think about it and how we can respond? I hate to go in there cold.
Yeah, it's probably, we're still kind of finalizing and honing it in. We may present it and talk about it at first, but it's not like it's going to be because I want to have the conversation and then have the document and then we'll set up some meetings for there to be lots of more discussion about it. So it's not like this is, here it is, decide what we're doing. You're going to have plenty of time. We're looking at, several weeks to give you to digest it. So don't feel that you're going to be caught off guard, but I'm probably also not going to turn it over until we get there, because we'll probably still be doing some fine tuning and editing right as we go into it.
Okay, so the goal is more of a presentation, and then
presentation, and then set up the meetings and conversations that will occur after to get feedback about that.
All right, thank you.
Anything else? Again, apart from masks, and are people feeling good about the flexibility they have, that they understand that the administration is, me in particular, I'm chief academic officer of the institution, so that the chief academic officer is comfortable and is saying that you do what you need to do to navigate during this period of time at which we're experiencing a wave of COVID infection. Anything else? Anything that you want me to do or would like for me to take back to the cabinet? understand more, being more, I can talk about what the UBHE can do and assertions, but anyway, anything else on campus that I can do within the confines of what I'm empowered to be able to do, or what we're empowered to be able to do. Similar meeting. Oh, okay. Well, I thought all staff were they all invited to this? Or is this just faculty? I thought I invited all academic affairs faculty and staff, but that's a regular conversation of doing things every time we send out meetings. How are we ensuring that the staff are feeling that they're getting equal representation? And so, okay, I can have staff, actually, some staff is within my purview of academic affairs. A lot of the staff is outside of academic affairs, but I can talk to them about how to engage them, because the issues are somewhat different, honestly, for staff than they are certainly for faculty, though they're interrelated. So I will certainly respect that. I received the email on your staff. Very good, Jessica. Thank you for coming. Staff. Yeah, okay. I thought I asked for all faculty and staff to be included, but well, I will go back and review the comments. I've tried to answer them as best I could, and if there's anything in there, or even after the fact, I think you're still able to put comments in there. If there's something that you think that we can do to be more effective and help you, I'm all ears and willing to implement anything, and we'll develop policies to do that. Again, as long as we're legally able to do so, and it makes sense to do so. Okay, well, with that, I appreciate you. Feel free to email me as well. The beautiful thing about being in a higher education, I guess in particular, but just the academy is, I welcome opposition. I don't mind being told that I've been, I say it goes back to my many years of refereeing. I've been told I made the wrong call. I can't even tell you how many times. So it's not something that I'm unaccustomed to, and certainly something that I'm willing to recognize. We all make mistakes and can move on, but I really want to do what we can to move forward together and again, get us through the pandemic as best we can. So certainly let me know what your thoughts may be, and we will see what we can do. And with that, I will adjourn our meeting. Thanks, everyone.